Hello friends, let us now learn some important points about the anatomy of thyroid gland. So now the topic is anatomy. So the thyroid gland is mainly located in the neck and it is located in the infrahyoid compartment of the neck. That is in the neck below the hyoid below the hyoid bone we will have the thyroid gland is situated. So thyroid gland is situated below the hyoid bone, that is in the infrahyoid region. And this thyroid is in relation to the trachea. This is trachea. So it is in relation to the trachea. It is in relation to the carotid arteries. It is in relation to the inferior jugular vein, internal jugular vein. So the thyroid is in relation to the trachea, esophagus. It is also in relation to esophagus also, carotid artery and internal jugular vein. Thyroid gland has two lobes, one lobe and two lobes. It has two lobes along with isthmus. The two lobes are connected to each other in the midline by an isthmus. So this isthmus is a thin structure which is present in front of the trachea. So this is trachea. In front of the trachea, we have this thin part of thyroid gland which is called as isthmus. So in 10 to 40% of normal patients, at this isthmus there is one more lobe which is present projecting like this, and this is called as pyramidal lobe. And this pyramidal lobe is only present in 10 to 40% of normal patients. So this pyramidal lobe arises superiorly from the isthmus. That is, it is arising above the isthmus, and it is also present in front of the thyroid cartilage. This is seen most commonly in younger patients because as age advances, so this pyramidal lobe is seen in young patients, and in adulthood, that is, as the age advances, this pyramidal lobe starts to atrophy, and completely this pyramidal lobe will become invisible by the time the patient reaches the adult age. So the size of this thyroid gland, that is the size of lobes of thyroid gland and also the shape of lobes of thyroid gland, vary widely among normal individuals also. That means the size may differ in each and every individual. So, for example, in tall individuals, the two lateral lobes, these are the two lobes which are two lateral lobes, are present elongated in shape. They look elongated in tall individuals, whereas in short individuals, the lateral lobes are mostly oval in shape in short individuals. So, if you see in newborn babies, just babies who are born now, they have the the most important diameter of the thyroid gland is actually an anteroposterior diameter. AP diameter is the most important diameter in the thyroid gland, right? So the AP diameter of newborns is around 8 to 9 mm, and the length of thyroid gland is around 18 to 20 mm in newborns. Whereas the same thing at the age of 1 year of age, the AP diameter is around 12 to 15 millimeters, whereas the length of thyroid is 25 mm. So at the end, if you see in adults like us, in adults, the length of the thyroid gland is around 40 to 60 mm, whereas the anteroposterior diameter is around 13 to 18 mm. And if you see the thickness of isthmus, in adults, isthmus is around 4 to 6 mm in thickness. The thickness of isthmus in adults is around 4 to 6 mm. Okay, so this is important thing about the anatomy of thyroid gland. And one more important thing is about the volume measurement of thyroid gland, which we see in the next class. Thank you.